The World Health Organization has just released a report on the status of health and care workforce in Europe. The main aim of the report is to present an overview of the workforce in the WHO European region for the first ever time. The focus is primarily on the main policy options available to countries which can help strengthen their health workforce to meet the current and future needs. On today's video, we'll take a look at why this report was created, what it found, and where it proposes countries should focus their resources for the future. So let's start with the why. The report states that the COVID-19 pandemic clearly demonstrated the strengths and fragilities of the health workforce in Europe. Many countries entered the pandemic with insufficient numbers of health workers, along with suboptimal skill mixes and a number of imbalances to geographical distributions. These national realities pose challenges to creating surge capacity and maintaining essential health services, both during the pandemic and while dealing with the fallout from it. The health workforce was under extreme pressure, having to cope with heavy workloads and job-related stresses. Health system recovery and future preparedness will fail without a strengthened health workforce. Therefore, the report declares that European countries must now prioritise their health professionals by investing more and investing smarter. And this brings us on to what the report actually found. It proposes key priority policy actions that can help countries strengthen their health workforce to meet current and future healthcare needs. It is aimed at policymakers at European, national and subnational levels across health and other relevant sectors. Interestingly, the health workforce in Europe has never been larger or more diverse in terms of available skills. This overall upward trend is clearly welcome, but other factors, such as the high percentage of aging professionals, is a concern throughout the region and poses a threat to the sustainability of the workforce due to the challenges of replacing workers when they retire. This is an especially pertinent area of concern for medical doctors. The report shows that 13 of 44 countries that reported data highlight that they have a workforce in which 40% of medical doctors are aged 55 or older and therefore close to retirement. So where can we go from here? Now, the report argues that it is essential to build on innovative strategies implemented during the pandemic, which will support and sustain an effective health workforce. Policy responses have involved ensuring the availability of more workers by deploying students in healthcare settings, by bringing back retired or inactive workers, using volunteers and fast-tracking deployment of foreign-trained professionals. Additionally, reskilling and repurposing the workforce and the accelerated use of digital technology have made a critical contribution to creating surge capacity and meeting the specific demands of the pandemic. The WHO and report authors have suggested that there are 10 actions countries can take to strengthen and build upon these policies. All of these interventions require intersectorial collaboration, engaging different ministries and government functions, as well as other core and key stakeholders. This is also important for us as healthcare educators and researchers, and something that INWA is very passionate about. If you also feel strongly about this issue and would like to contribute, please get in touch with us regarding our ongoing efforts in this space. And that brings us to the end of our video. Thanks for watching, and until next time, goodbye.